Good afternoon. My name is Anna, and I will be your conference operator today. At this time, I would like to welcome everyone to Improving Nurses' Healthy and Health Wellness conference call. All lines have been placed on mute to prevent any background noise. After the speaker's remarks, there will be a question-and-answer session. If you would like to ask a question during this time, simply press star, then the number 1 on your telephone keypad. To withdraw your question, press the pound key. Thank you. Ms. Sue Hasmiller, you may begin your conference.
Thank you. Good afternoon and welcome, everyone. Thank you for taking time to join us today for this webinar, Improving Nurses' Health and Wellness, sponsored by the Future of Nursing Campaign for Action and the American Nurses Association. We'd like to let everyone know this webinar will be recorded and available on the campaign's website at campaignforaction.org. Today, we will be discussing, next slide, please. Today, we will discuss data on the status of nurse health, safety, and wellness through an ongoing health risk appraisal. I think we need the next slide. Sorry, everyone. Maybe everyone else is seeing the next slide, and I'm not sure. I'm just going to continue.
Okay, I apologize. They just joined me back into the webinar.
Okay.
This is Christine.
Okay. Thank you. Sorry. Sorry, everyone. Today's webinar, here we go. Our objectives for today: discuss data on the status of nurse health, safety, and wellness through an ongoing health risk appraisal. Number 2, examine the Healthy Nurse, Healthy Nation Grand Challenge and specific ways you can engage. And number 3, learn how action coalitions are implementing Healthy Nurse, Healthy Nation in their communities. I'd like to begin by stressing that nurses, next slide please, I'd like to begin by stressing that nurses are uniquely suited. And many of you who know me will have heard me say this before, nurses are really, really uniquely suited to play a significant role in building the best health and well-being for our nation. They are educated to see each person for whom they care in the context of his or her life, all the factors that impact a person's life and well-being. You remember those are called the social determinants. Ironically, nurses are well-suited and skilled to promote health in others, but often aren't very good at promoting their own health. So here we are today on this webinar. Healthy Nurse, Healthy Nation is an excellent way to inspire nurses to pay more attention to their own health as leaders and role models. In order for nurses to take on the leadership roles in building a culture of health, no matter what their jobs are, they first have to take care of themselves. Nurses cannot give what they don't have. Please note on this slide that you can find out more about the Foundation's mission on building a culture of health by going to rwjf.org and cultureofhealth.org, and to find out more about our campaign and how we're working on this by going to campaignforaction.org. So now I'd like to introduce our speakers on today's webinar from the American Nurses Association, Jamie Murphy-Dawson and Holly Carpenter. Jamie is the Director of Program Operations for the Healthy Nurse, Healthy Nation Grand Challenge for ANA, and Holly Carpenter is the Senior Policy Advisor for ANA. Before I turn it over to them, let me add that you can begin to populate your questions by using the chat function. We will address as many questions as possible after the speakers have presented at the end. So thank you, and I turn it over to Jamie and Holly.
All right, thank you so much, Sue. Next slide, please. So Holly and I are going to talk to you about the Grand Challenge and let you know specific ways that you can get engaged. And next, on the next slide, I want to provide a quick overview of the ANA's commitment to improving the health of nurses. And we're doing this work because we know that when nurses are healthy, they are more likely to counsel patients about healthy behaviors. And when they do so, they're viewed as more credible. Next slide, please. On this slide is ANA's definition of a healthy nurse, which is defined as one who actively focuses on creating and maintaining a balance and synergy of physical, intellectual, emotional, social, spiritual, personal, and professional well-being. Next slide, please. because we know that nurses, as the largest subset of workers in our healthcare system, we know that their health is critical. So if nurses themselves were to become a healthier population, that's 1 in every 100 Americans. So that's 3.8 million registered nurses. And as I mentioned, nurses are more credible, perceived as more credible when they're healthy themselves. And at the end of the day, this means that they're more likely to be perceived as positive role models and to advocate for patient health. Next slide, please.
I don't want things to go wrong.
I think we have some feedback on the line. If we can make sure that other speakers with open lines mute the line. Thank you. In May of last year, we launched the Healthy Nurse, Healthy Nation Grand Challenge. And here is a screenshot of hnhn.org. And we encourage everyone on the line to take a look at this website. And from this page, you can join as an individual or as an organization. And I'll talk more about the specifics of joining in a moment. Next slide, please. And here's our 10,000-foot vision of the initiative. We are seeking to engage nurses in multiple different ways. First, we want this to be a place where nurses can come to assess and improve their own health. We want to connect nurses with organizations that represent them, including employers and state associations, and also schools of nursing. And last, we want nurses to connect with each other through friendly competition, through buddy systems, through systems of accountability and support. And we're seeking to address health in 5 areas: physical activity, rest, nutrition, quality of life, and safety. And in a minute, Holly will walk you through some of the data. But what we're seeing from research, our research, is that nurses are less healthy in all of these areas than the average American, and that's what we're seeking to improve. And our vision statement's here at the bottom, that if we can work to create a healthy nurse population, this will ultimately lead to a healthy nation. Next slide, please. And one of the ways we're seeking to do this is through the platform that you can find at hnhn.org. I mentioned that you can join as an individual and an organization, and this slide really talks a bit more about the individual experience. And joining is available at no cost, and all nurses and nursing students are welcome to join. So upon registering, which just takes a few minutes, and if you're an ANA member, you simply log in with your member's credentials, you're prompted to take a survey, which is a comprehensive health risk assessment. You take the survey and you see a heat map of your results, which Holly will show you, and then you're prompted to take action based on your results. And so this could mean joining a health challenge, or it could mean going to our resource library to access maybe a position statement or a continuing education course on a variety of subjects. And we want to also have people who join participate in our discussion boards and read our blogs and join our private Facebook group to connect directly with other nurses for support. We have, as I mentioned, the survey, and this is an important way for us to track our progress over time. And so nurses will be asked to take the survey every year, and so this gives us a way for longitudinal tracking, but it also gives very specific feedback as a nurse is progressing through his or her health journey. And as we partner with organizations, we're able to collect and share data with organizations. Confidentiality is extremely important, though, so the data is de-identified and aggregated. But this allows organizations to track their progress as partners, too. Next slide, please. And I'm going to turn it over to Holly now to take a deeper dive into our platform.
Good afternoon, everyone. So one of the first things that we ask people to do is go ahead and set up a profile page, very similar to other types of social media. You can upload a photo, do a brief bio of yourself, and then one of the most important things you can do is add a primary and secondary affiliation. And so your 2 affiliations may be with your employer, with your professional organization, with your school of nursing. It's up to you, whatever you choose to put your primary and secondary affiliation. And that is only if they have joined as a partner or a premier partner. So don't be concerned if you don't see them, but certainly suggest to them that maybe now is the time for them to become a partner. This page where you, your profile page is where you can show what badges you've earned, you can collect friends, Obviously, we want you to connect with other people. You may reach out to a specific subject matter expert that you were intrigued by. So this is really your spot where you can reach out and do what you feel that you would like to accomplish with this. Next slide. This gives you an idea of what, once you take our survey, our Healthy Nurse Survey, which takes about 15 minutes to complete, you get your results immediately. And this is just a tiny portion of what your results will look like. As you can see, Jamie had told you about there's 5 different buckets or domains where nurses are kind of lacking, and they're rest, safety, quality of life, nutrition, and physical activity. So you can see you'll have little icons for each question. Now what this shows you is that green is low or no risk, yellow is medium risk, red's high risk, and you can't see because I was just able to do a portion here, but gray or lavender means that you skipped the question or was not applicable to you. Next slide. Now you click on, those buttons are interesting because you can see, if you're mostly green, you're feeling pretty good. If you're mostly red, you're like, yikes, I really need to make some changes here. But to really get into the nitty-gritty, you click on any of those boxes, and immediately the box blows up and shows you the original question, your answer, the ideal answer, the national average, references where we got that ideal answer and national average, and then different resources so you can explore, for say it was in nutrition, you can explore that topic a little bit more in depth, get some assistance with that if it's something that you got a red or yellow with. Next slide. So after you take the survey, you certainly will have some food for thought, so to speak, to think about. Then we ask you to make a commitment, or in January, as we call it, make a resolution. And these commitments or resolutions do not need to be about losing weight or running a marathon. It can be anything to do with your health, safety, wellness, quality of life, sleep. A lot of people say that they're going to try to get 7 to 9 hours of sleep. They're going to drink more water. They're going to learn to say no more. They're going to spend more time with a child or a grandchild. So it's really anything that you feel like will really serve you the best. So that's the commitment. Next slide. So we're going to go briefly back to the survey now. We're going to look at some of the results of the survey. As you can see, these are the top 10 workplace risks that nurses have identified on our survey. And head and shoulders above all is stress. So at 79%, nurses are about 2.5 times more than the average U.S. worker. So you can see we have a lot of work to do with stress. Lifting heavy objects is second, and this includes safe patient handling, so it's not necessarily just lifting a piece of equipment or something. It can also be a patient. Prolonged standing, sharps injuries, fatigue, different types of exposures, bloodborne pathogen exposures, infectious disease, slips, trips, falls, unsafe staffing, and also noise level. Next slide. Nurses cannot be safe and healthy if there is workplace violence, incivility, or bullying in the workplace. We have several questions on these topics. In spite of the answers, only 10% are concerned for their physical safety, but 30% have experienced some type of bullying or aggression from a peer in the past year, and almost 1 in 4 have experienced bullying or aggression from a person in higher authority. Next slide, please. Safe patient handling and mobility is also a key to nurses' health, safety, and wellness. So some of the questions we've asked is, does your facility have a safe patient handling and mobility program? 76% say yes. About 72% have access to technology equipment. Only 52% find that it's easy to use and can find it and that it's available. Only 22% actually get involved in the selection of what technology will be used on their floors. 61% feel like they've had adequate training, and only 42%, so it's less than half, use technology every time with every move. And this may explain in part by 55% experience musculoskeletal pain at work. Next slide. Here's some general wellness questions. 62% of us feel like we have access to worksite wellness promotion programs, but of that 62%, only 40% actually participate in them. This is kind of a sad figure here. 45% of us don't participate in any vigorous workouts weekly. Only 14% of us eat the recommended 5 fruits and vegetables daily, and 14% of us have also nodded off while driving in the last 30 days. So I always like to end on a high note with this, but 91% of us have received our influenza vaccine in the past 12 months, so good job on that. But you can see from these results, we do have plenty of work to do, and there's definitely a need for Healthy Nurse, Healthy Nation. Next slide. So we have various challenges that we do. For 2018, we will be doing about 2 challenges every month. And right now we have What's Your Resolution challenge going on. And this is where we're setting up people to make doable, reasonable resolutions and then actually keep them and follow them through the year and follow up with them, see how they're doing. Some other upcoming challenges, you can see Get Your Gratitude On, but we're also doing an Increasing Nurse Resiliency challenge, cutting down on fast food, and then also an Increasing Whole Grain Consumption challenge, so trying to eat more whole grains and getting those into your diet. One of our most popular challenges was getting the 5 fruits and veggies in people's diets daily, and we got some beautiful photos of people with their and sharing recipes, and people really took it to heart. A lot of people, once the challenge ended, kept it up, so we were really pleased with our results with that one. So, of course, we do have next slide. We do have a community board that you can post on all 5 of the different domains. Here someone was posting on their STEP challenge in the physical activity. And what's great about this is that people are able to challenge and support each other, and they're increasing their own accountability and their success. But it's not always just things like this. We had a wonderful post from we always hear from people that were bullied, and we actually heard a wonderful post from a lady who admitted to being a bully, and she kind of detailed out why, how it got started, how she hadn't realized she was a bully, and then the steps she had taken to change that and to apologize for her behavior and make amends. And I think that when most people read that, they did see a shade of themselves in that. So it was very helpful, and just something a little out of the ordinary, and we were very grateful for her courage that she was able to post that. We also have several, next slide, sorry. We also have several blogs that get posted every month, and these blogs can be anything from easy exercise for everyone, increasing protein in your diet, this specific one that's posted, moral distress, what it is and what to do about it. But we also take their time with our blogs and spotlight specific facilities, premier partners that are doing amazing work with their nurses and really transforming their nurses' health. And we also take the time to spotlight and highlight you, the individual nurse, and show the changes that you're making, and just talk about what's going on in your life and what the great changes that you personally have made as well. Next slide. I'm going to hand it back to Jamie.
All right. So I want to end with just some very specifics about how you can get involved. I think we covered a bit of this, the other sort of pieces that are included in the Grand Challenge, so we can move on to the next slide. I want to talk for just a minute about partner onboarding. So we really kind of walked through the individual experience here. We want to encourage all of you who are part of healthcare organizations, state associations, schools of nursing, to also join as partners. There are 3 different levels. The first is a premier partner. We encourage premier partners to ask nurses to join our platform so that we can collect the survey data and we can engage in those challenges and activities together. But we also ask our premier partners to make a very specific, tangible commitment to improving the health of nurses. And that's looking like things like STEP challenges at the state level, or an association improving the types of food that they serve at an annual conference, or a cafeteria reducing the amount of sugar-sweetened beverages that are sold. So those are very specific changes that we will collate and we will share best practices through the Healthy Nurse, Healthy Nation community. And then the partner level is engagement in the community, using our toolkit to spread the word and asking nurses to join us. And the friend level is for those who want to support the Grand Challenge through communication messaging, and that could be as simple as a tweet here or there or an article in a newsletter. So visit hnhn.org or contact Holly and I if you have interest in joining as an organizational partner. Next slide, please. This is certainly not a comprehensive list of our partners, but if you visit hnhn.org, you'll see our list. This is going to be updated on an ongoing basis, but this gives you a sense of sort of the types of partners that are involved. I want to emphasize that 80% of state nurses associations have joined. So this is a great opportunity for connection and collaboration at the state level. Next slide, please. We mentioned the challenges, and we like to focus our newsletters, our biweekly newsletters, on the stories of our partners and individual nurses who are participating. And we also are running contests to encourage engagement. We just finished a Partners All-In contest where we awarded $5,000 to the partner who onboarded the most nurses during our contest period. And we'll be doing more things like that in 2018. Next slide, please. Some of our metrics, and these have changed a bit in the week and a half since we did these slides, but we have about 12,200 nurses in our community, about 2,200 nurses in our private Facebook group. We have over 7,000 nurses who have taken our survey, and we have 280 partners nationally and almost 26 million impressions on social media. And so this is a good start for us, and we want to work together to really, really grow in 2018. And we'll look forward to working with all of you to do that. All right, so that concludes my presentation. On this next slide, you'll have our contact information, and please don't hesitate to get in touch, and we hope you will join if you haven't already. Thank you very much.
So thank you, Jamie and Holly. This is Sue Hassmiller again, and you have heard from the American Nurses Association, and now I'd like to turn it over to two wonderful ladies who are representing our Campaign Action Coalition. Representing our Campaign State Action Coalition today, we have Robin Schaefer and Maria McPherson. Robin is the Executive Director of the Arizona Nurses Association, and Maria is the Deputy Director for the New York State Department of Health. Both of them will share examples from their own states. So, Maria, I think you're up next.
Okay, thank you. So we'll just start with my first slide here. I have been involved with the Future of Nursing New York State Action Coalition for a couple of years, and part of that work was to create a culture of health booth at the fair. And so we're going to talk a little bit about that, talk about the action coalitions themselves in New York, what they look like, and how most recently we work to include themes around Healthy Nurse, Healthy Nation. So first, New York State. We're a fairly large state. The Action Coalition was actually founded in 2010 as part of a grant, one of the first 5 Action Coalitions funded. New York State was divided into 7 regions and works under the 3 co-leads, and our co-leads are located throughout the state and provide guidance. The Action Coalition linked with all of the schools of nursing and many different community nursing organizations as part of their work. Each region has a co-lead as well, and that's the person who's involved in promoting and reaching out to stakeholders and nurses in that region, and that's where the actual work of the coalitions occurs. In New York State, the coalition is housed with the Center for Nurses at the Foundation for New York State Nurses, and that was an important linkage. The foundation was in existence long before the Action Coalition, and the foundation's mission is to promote nursing leadership, research, and nursing education to enhance the health and well-being of all New Yorkers. So it was really a very good fit for this work. The New York State Action Coalition is organized around a number of different priorities. You can see them here. All of that work comes under 4 different pillars, and those pillars are nursing education, nursing leadership, diversity in nursing, and scope of practice. And within that, there's a lot of different work that goes on. It includes things like nurses on boards, coalition, activities to promote nursing education and nursing practice. And in New York, we have had some success in that area, and I'll just comment on the number of new RNs graduating with a baccalaureate degree has surpassed the number of RNs from other programs since 2013, so that's a huge success. We also were able to pass the Nurse Practitioner Modernization Act in 2015, which addressed scope of practice. And just this past fall, our governor signed into law the BSN in 10, which will require future nursing grads to have a baccalaureate degree as their foundation for nursing practice. So those are some of the successes. There are many others. Throughout all of that work is a thread and a recognition related to diversity in nursing, because we understand that the nursing workforce has to reflect the population that we serve. And so that's something that we consider in all of this work. And together, all of those pieces work to build healthier communities throughout the state. This is a pictographic of the work of the Action Coalition. It was actually created by Lucy Alfano, who's our Culture of Health Breakthrough Nurse Leader. And again, showing how those columns of work, education, leadership, diversity, scope of practice, work together with all of our community partners, the 121 different schools of nursing, healthcare providers, organizations, New York State Department of Health, with a goal of working together to improve population health. So just kind of one way of looking at the work that's been done. But the booth at the fair. So let's talk about this for just a little bit. The Action Coalition started having their first booth at the New York State Fair in 2013, and that was started with ANA New York as the founding partners, the Foundation of Nurses, and Keuka College students took a lead in those early years. And the purpose of that booth was really to promote the Institute of Medicine recommendations that were from the Future of Nursing report. And they did that very, very well. By 2016, the Action Coalition Planning Committee for the booth agreed to add the theme of nurses promoting healthier lives. And that was the first time that they really started to look at culture of health themes in addition to the Institute of Medicine recommendations. And that was the year we created the logo you see in the top right, the nurses, and it says promote healthier lives. And the blue box on the lower left corner was a fan, a paper fan that we created as a giveaway, giving people the website and really, again, promoting that future of nursing practice. That year in 2016, there were other partners participating, such as VNA, New York State Department of Health, many retired nurses, practicing nurses, students came on board. Lemoyne came on board at that time. By 2017, the board, the group that was planning the work of the fair expanded again to another school of nursing, SUNY Upstate, and more of the local nursing organizations. And that was when the group agreed to adopt the theme of Healthy Nurse, Healthy Nation, and focus on those 5 domains of health along with promoting community health. And so we added that, and what you see along the bottom is the Healthy Nurse, Healthy Nation theme. Same 5 domains you've heard talked about. For ANA New York, they used that yin-yang sign, and so they added the idea of work-life balance. So why the fair? If you've ever been to the State Fair in New York, it's a big deal. I can't speak to what happens in other states. New York State Fair has been around. It's grown significantly from its early 2-day event in 1841 to what it looks like today. Today's fairgrounds is over 375 acres of permanent buildings, all kinds of booths, different venues, people of all kinds, activities of any variety. The largest fair that we've had was this past year with 13 days of fun-filled events, and over 1 million people attended this fair. Because of the population of people at the fair, and on any given day that the fair is in existence, the fairgrounds becomes the 6th largest city in the state of New York. That is a lot of people. The booth that I've talked about for the Action Coalition really has been working hard to promote the culture of health, including a focus on both individual health factors, the themes, domains from Healthy Nurse, Healthy Nation of physical activity, nutrition, rest, quality of life, and safety, as well as really promoting partners and discussions around community engagement. And volunteer activities would be things like participating on some sort of group or board, committee, or a council that addresses health-related activities, volunteering time or money to a health-related organization or community activity, or things along the idea of political advocacy and voter participation. But the conversations around individual health were really the things that were easiest to have while at the fair. They were the things that the nurses related to and that our participants were most interested in. So how did we do this? We spread white paper out on a table, put a box of crayons and markers and a sign asking, what do you do to stay healthy? And we would ask kids to come up to the table, talk to us, draw pictures, what do you like to do? While we were engaging the kids was also an opportunity to talk with their parents. What about you? What do you do for health? Do you eat fruits and vegetables? How much sleep do you get? Let's talk about some of those things. What about in your community? How might you be involved? Because we were a nursing-related booth and we'd been there for a couple of years, people would come and seek us out. And they would ask questions about nursing practice, nursing education. They would share information about their stories. So there were many, many opportunities to have these conversations about health and well-being. This last year, we also added a selfie station, and you see some pictures there with props to really encourage people to think about being healthy, take a fun picture, do whatever they wanted. It was their picture, but to think about sharing it perhaps on one of the social media sites. And we've always invited our community partners to have a table at the booth, not for the whole time, but maybe just a day, and talk about health-related activities. And those have been fun events. The booth is staffed by a lot of volunteers. We try to teach them before the fair starts about these concepts of health and wellness and how to go about doing it. From some of the pictures from 2016, we actually took all of those words and things from the kids and created the pictograph that you see up there on the left. And what you can see is that kids very easily recognize physical activities, nutrition, family. They talked about things like brushing their teeth and sleep and all of those things. Adults in the conversations and the survey information that we collected were aware of those things, but as you heard from the Healthy Nurse, Healthy Nation survey, adults are not good about doing those things. So we know what we need to do, but we don't always follow through. Because there were so many nurses locally who participated in this event and they were interested in what we found, we did share this information this past December with the local group, and we wrote up a short newsletter article that will be coming out in ANA New York Spring Newsletter about this, and again, speaking about these individual domains of health. And we'll continue to look at some of the information that we've gathered and see how that might guide the Action Coalition moving forward. So the New York State Action Coalition recognizes this intersection of nursing leadership, a culture of health, and Healthy Nurse, Healthy Nation. If you've ever looked at the IOM report, within there is this quote, and it states, knowing is not enough, we must apply. Willing is not enough, we must do. So I think really the question that really we have to ask ourselves is, what are we willing to do? Collectively as nurses, individually for our own health, are we willing to change some of our behaviors or the things that we might already be doing or that we want to do differently? And so I ask each of you, will you accept this challenge? What will you do to improve your own personal health and the health of your communities? We've given you lots of ideas today. Maybe you can take some of that and move forward. Thank you.
Hello there. This is Robin Schaefer, and I am the next presenter. And I'd like to thank Maria for that question at the end of her presentation, which is a great segue into mine. I thank you for inviting me to this webinar. I represent the Arizona Action Coalition, the Arizona Nurses Association, and the Arizona Foundation for the Future of Nursing. To clarify, the Arizona Foundation for the Future of Nursing is the philanthropic arm of the Arizona Nurses Association. Our Arizona Action Coalition is housed under our foundation umbrella, and I am the co-lead, one of the co-leads of that Arizona Action Coalition. Our work and pillars are very similar to the New York State pillars that Maria identified. Since the focus is Healthy Nurse, Healthy Nation, today I'm going to focus on the work around that initiative, and a lot of that is being delivered through the Arizona Action Coalition. I just have to say Arizona is a much smaller state than New York, so our work actually flip-flops among all the different partners in the state. Next slide, please. The Arizona Action Coalition, the Arizona Nurses Association, or as we call it, ASNA, was an early adopter of the ANA Healthy Nurse, Healthy Nation Grand Challenge as a beta site state for the website and engagement platforms. As we planned our 2016 Nursing Symposium, we used the Healthy Nurse, Healthy Nation theme and added the layer of patient, which attracted nurses from all over the state of Arizona. Jamie and Holly, our presenters on this call, actually traveled to Arizona and presented the Healthy Nurse, Healthy Nation information at our symposium, similar to what you heard today. We also added some self-care presentations. Our Arizona nurses loved it and took action that day. Next slide, please. As a result of comments and conversations in the conference room, attendees, nurses, challenged each other to change just one number related to their health. It could be lowering cholesterol or blood pressure, or something as simple as drinking only one Diet Coke per day versus the 6 they had been drinking. The conference extended to personal Facebook pages where each nurse challenged their Facebook friends to also change one number related to their health. Next slide, please. This word cloud reflects the symposium evaluation question, state one change you will make in your life as a result of this conference. What a powerful and impactful message. Although we never conducted a 3 to 6 month follow-up on attendees, which I'm really sorry we never did, my nurse colleagues did give up diet soda, lose weight, discontinue their cholesterol meds through modification of diet and exercise, and much more. Many of us were accountable to each other, which also helped. Next slide, please. Next, I would like to highlight the Healthy Nurse, Healthy Nation work of our two of our geographic chapters in Arizona. First, our Yuma, Arizona chapter. Yuma is a city in the southwest corner of Arizona bordering California and Mexico. The population in Yuma is only 100,000, except during these winter months when we have an influx of visitors. There is a very strong and collegial nursing community in Yuma. Many nurses work for Yuma Regional Medical Center, both inpatient and outpatient, and the Yuma Regional Medical Center has strong ties within the community. Our Yuma nurses hold an annual conference and adopted the Healthy Nurse, Healthy Nation theme for their 2016 and 2017 conferences. Topics such as stress management, mental health, yoga were some favorite topics. Another focus of the conference was the review of the results of the Yuma Regional Medical Center's Community Health Needs Assessment. Our Yuma chapter partners also partner with the Yuma Hispanic Nurses Association and the Regional Center for Border Health to serve their community. The Regional Center for Border Health is committed to improving the quality of life of residents along the U.S.-Mexico border by accessibility to quality training and affordable health. Many of our Yuma nurses either work or volunteer for that center. Next slide, please. Our East Valley chapter, located east of the Phoenix metro area, serves a population of 1.4 million people, quite a contrast to Yuma's 100,000 people. In 2014 and 2015, the East Valley nurses traveled to Las Vegas to sponsor a water hole during the National Nurses Half Marathon. Although this marathon only ran for 2 years, it was a great creation by Helene Neville, who is the nurse who has completed her goal of running the perimeter of the United States. You can see from the picture on the right that our East Valley nurses, including myself, I'm in the back, I'm in the bottom left, and our president, Kathy Ruck, of our East Valley chapter on the bottom right, we had a great time with our theme, Oasis in the Desert, and came in second place for the most creative water station. Next slide, please. Continuing with the work of our East Valley chapter, who were actually trailblazers in the Healthy Nurse, Healthy Nation concept, they held their first renewal retreat for nurses in 2014. The retreat is 2 days and uses mostly nurses as presenters, with the intent of nurses giving back to other nurses. Topics include meditation, yoga, mindfulness, healing touch, communication, relationships, nutrition, and stress reduction. The retreat continues to sell out every year. This chapter also adopted ANA's Fit Nurse Friday, always sharing the ANA Fit Nurse Friday Facebook postings and participating in the Fit Nurse 5Ks that ANA holds as part of Healthy Nurse Healthy Nation. So basically it's a virtual 5K where each organization gets a group of nurses together, and in our state we met at an Arizona trailhead, of which we have many in Arizona, and would walk or run the 5K together. Additionally, as a result of our East Valley chapter work, the hospital that our chapter president works in also adopted ANA's Year of the Healthy Nurse theme. They took the monthly focus topics and created monthly activities for each unit. For example, Healthy Eating Month had the theme, Get Our Greens On, where units were challenged to a vegetable potluck. Next slide, please. This is just a picture. I attended the 2017 renewal retreat. I'm in the back over there with the purple shirt on, and I have to tell you it was life-changing for me. And this next theme this year is going to be resilience. Next slide, please. Mayo Clinic Phoenix campus is a premier partner of the Healthy Nurse, Healthy Nation initiative and takes their role very seriously. At the 2017 convention of the Arizona Nurses Association, members Jasmine Bhatti and Lauren Lugiachani, employees of the Mayo Clinic, were given time at the podium to present a project that the Mayo nurses and their administration produced. With the title of Nurses Believe, this 5-minute, 40-second video delivers the message, nurses care for their patients, so much so that they often neglect fully caring for themselves. This video is trending well on YouTube. Next slide, please. ASNA has a Facebook-like social media site called Social Link. Our members join and post to other members. Posts like this one challenge our members to share and support each other. Holly already told us that this was a successful initiative, and I have to say we had the same experience here in Arizona. We had so many nurses sharing recipes and supporting each other. It was wonderful. Next slide, please. My last slide focuses on community partnerships. So ASNA is a community partner for the Live Well Arizona initiative. This wheel was designed in 2017 for the Year of Healthy Communities in Arizona. This has been extended into 2018 and beyond. The concept is, effort starts with the notion that building individual and collective momentum can enable everyone involved to reach a higher level of success. This great work is underwritten by Vitalis Health Foundation here in Arizona. Work is done in various cities and towns, and anyone can participate by accessing the website livewellaz.org and drilling down into the various community elements. There are initiatives going on in many of the towns in our state. With that, I will turn this over to our moderator.
Thank you, Robin, and thank you, Maria, and our colleagues from the American Nurses Association for joining us for this webinar. I think it was great to have the vivid examples as they are operationalized in New York and Arizona, and really appreciate that. I want to apologize to everyone for their difficulties in getting onto this webinar. It was a glitch beyond our control, but we will deal with that the next time and apologize for that. And these slides will be available. Chris Bukowski will send us a link via the chat and let us know how to get those slides. So we look forward to your questions. If you have any questions, I actually didn't see any questions related to the topics. They were mostly glitches about getting on, and I really apologize about that again. And so let me ask a question of Jamie and Holly, or any of our presenters. Do we have any other examples from any of the other action coalitions? I think I saw Victoria Vinton's name on there earlier from Nebraska, and was wondering if she can, I don't know how easy it is, probably not too easy to have her speak and get on the line, but wondered about other examples as well. Is there a way that we can get Victoria Vinton on, operator?
Yes. Yes. If you would like to ask a question, please press *1 on your telephone keypad. That is *1. And we do have Miss Victoria. I'll go ahead and open her line.
Thank you. Victoria, so what's happening in Nebraska?
Hi, Sue. Thank you for asking. Last year in 2017 during Nurses Week, Nebraska, in collaboration with the Nebraska Nurses Association, did Healthy Nurse, Healthy Community, which was a spin on Healthy Nurse, Healthy Nation. And the NNA's director, Melissa Florell, introduced them to Healthy Nurse, Healthy Nation. And then the Nebraska Action Coalition followed her presentation with looking at the nurses' health and how important it is to the health of a community. So we had a 1-hour presentation as a gift for Nurses Week so that they could earn CE. And we traveled 1,200 miles across the state visiting 6 different communities and
wow.
one partner here in Omaha, and had good feedback. It's a good way to reach out across the state and let folks know that we know about them and care about them, and just to bring them to the thought of gosh, I really need to look at my own health. And just sharing things personally, like I know when I took the survey, I am not very good about not using my cell phone in the car. And when it came back to me that was a safety issue as part of my health, I was like, well, absolutely, you're right, it is. So the survey can be an eye-opener, and we hope to continue this, even though that was the theme in 2017. I think it's very necessary work that needs to continue across the country, and just keep that on the radar for nurses paying attention to their own health.
This is
Great.
Jamie from ANA. Can I speak up for just a moment?
Please do.
Well, I'm so glad that you made that comment, Victoria, because the 2017 theme was the year of the Healthy Nurse, and Healthy Nurse, Healthy Nation is designed to go far beyond 2017. So we hope to be doing this work for many years to come. But thank you for raising that point and allowing me to clarify.
You're welcome.
Wonderful. Thanks, Victoria. Thank you. So wondering if there are any other examples. Operator, you said *1, is that right?
That is correct. *1 on your telephone keypad.
Yeah. So if anybody would like to come in by voice, please do so. We'd love to hear from you. Anybody else have any examples in the listening audience that I think might be replicated? Anybody coming on?
We do have Joanne Weidmer.
Wonderful.
Hi.
Joanne.
Hi, this is Joan.
Go ahead.
Yeah, it's Joan, but that's okay. Joan,
Joan.
the New Hampshire Nurses Association. Hi.
Oh, good. Hi.
I know you shared this with one of your newsletters, but we inaugurated last fall a Healthy Nurse Scholarship 5K, where we partnered up with one of the schools Student Nurses Association and held a 5K on their campus, and we also added a health fair where we brought in organizations such as the American Heart Association, Breathe New Hampshire, the Holistic Nurses Association, and many, many, many more. We had 22 organizations that provided wellness-related information that was available for our 5K participants before and after the event. We will be holding it again this year in October. It's on the 20th. So we were real excited, and then we used the proceeds to create something that had been a personal goal, which was a scholarship fund to provide scholarships for nurses pursuing additional education and for nurses trying to get certifications.
Oh, I love that idea. I really, really love that idea. Wow. So you had good participation by the nursing students themselves, too?
Well, the nursing students wasn't, we had a lot of helpers, but one of the reasons we moved the event to October this year is we did it the week after they came back to school. So we didn't get enough participation in September, plus it was hotter than heck that day. It was like 93 degrees, which in New Hampshire is unusual. Yeah, so it was really hot. So we pushed it back into October, so we're hoping to get more student involvement. We also will be promoting it more heavily early on. So we had about 70 participants in the 5K, which for a first-time out event, we were satisfied with that. So
I love
decided
it. I love
to try and do it again.
Yeah, the scholarships are for them, so they should come out, right?
Well, the scholarship is more for existing nurses. It's designed for nurses that are already have achieved their RN certification but are going back, particularly for the BSN, RN to BSN.
Great idea, to encourage people to go back for their BSN. I love it.
You got it.
Even more. Oh, what a great idea. That's easily replicable. Wonderful.
Exactly, and if anybody out there wants to do it, I'm more than happy to give some guidance on lessons learned, and we'll be moving forward, and we'll keep you guys apprised of what we do this year when we get closer to that date. So that's
fabulous idea. I'd love to see someone replicate that. Well, at that, we are at the 5 o'clock hour, and I want to thank everyone for participating. I wish we had more time. I love it when we can get on and discuss, and we just didn't have a lot of time, but I thank Victoria and Joan for being brave and coming right on. Victoria didn't really have an option, right, because I made her get on, right, Victoria? But Joan, thank you for volunteering, and thank you, everyone, for being part of this webinar today. Have a wonderful day.
Presenters, please stand by. Ladies and gentlemen, this concludes today's conference. You may now disconnect. Thank you for your participation.